Hello, everyone. Welcome, sons. Welcome to today's presentation. It's 11 a.m. exactly, and we're just going to wait a little bit longer. We are action-packed today. I just want to say this session is, when I was putting it together, I didn't realize what great speakers we have. And I was joking before we started is, we definitely have the A team. I'm dating myself, or the Avengers, right? This is a really great action-packed session with community partners. So we want to make sure you have the best experience today. Connect your computer, make sure you're all connected, close unnecessary windows, use the chat for any questions to the panelists. If you're available now, just put what facility you are. We'd love to see where you're from. We will also be recording and it's closed caption. So we're going to get started. And right now, this session is Sun Training 101, strengthening community connections. And that's why we have all about community partners. But two things just before we get started. I wanted to remind everybody of the Sun landing page. If you do not have the link, it is the one-stop place to go to everything. We'll put it in the chat in just a second. And it's a great tool because it just takes you right to the training session. So we really want to promote that. And the second thing is, I know I mentioned in the past what we're doing is some secret shopping. So we may call your facility in your hospital operator or your hospital ED and just ask to speak to a substance use navigator. We've gotten some interesting things. So, again, this is not a right or wrong, or good or bad. We're just promoting awareness of our program, right? We want you to promote your program and be confident that your hospital knows what you're doing. So definitely we have a tool for that, and that was posted in the chat. It's a hospital education tool, and you can use that to speak with your hospital operators, your ED clerks, unit secretaries, unit clerks. So again, those are two valuable, the Sun landing page and the hospital education tool we put in the chat. So moving forward, we are part of the Public Health Institute and our materials are made available. That's the legal stuff that we need to talk about. So today's agenda and objectives, everyone, we have some inspiration with Josh Leftig, our regional director. We have a community partners panel that's just awesome. Can't wait. Community and patient advocacy by our Sun mentor. And we're going to have some stories from our wonderful storyteller, Tommy Trevino, and tips for some mentors. You also see our objectives for those of you that need CEU credits. This is available for 1 CEU credit. So without further ado, to be corny, I guess, we have our favorite harm reduction regional director, Josh Leftig. He's just amazing, and he really has some inspiration today. I'm excited. He got me curious. He is the Department of Emergency Medicine physician assistant, investigator, and clinical instructor of the emergency regional anesthesia at Highland Hospital, Alameda Health System. So I am going to hand this off to Josh Leftig.
Hi, well, thank you so much for that intro, and I'm really excited to be here. I just love seeing everyone's names popping up in the chat, and thank you for having me give some inspiring, a moment to give inspiration. The substance use navigators are my inspiration 100%, and so it's good to give back some inspiration. I'm going to try to, I do think I need privileges to share my screen, if that can be granted to me, so I can get my deck going. There we go. Okay. Okay, and there we go. Okay, so naloxone from the ED. So this is building on what we were working on last week, which was an overview, which was a step-by-step of getting naloxone going from the ED. And again, same disclosures that Sherry just gave, and I have no financial disclosures or conflicts of interest. So the first sort of celebration is how far we've come. Um, the we started off with an impact statewide of no impact with naloxone distribution. We had 0 EDs distributing um, naloxone using a high volume, low barrier method. Fast forward to June 2020, so a little over a year ago, and we had 29 EDs distributing naloxone. And these were early days. This was Rebecca will remember, kind of it was a little harder lift to get hospitals going because there wasn't a critical mass of hospitals. So now, as of last month, we have 80 hospitals distributing naloxone, which is amazing. So that year over year growth just shows the interest and excitement that is building around this project. And this is really attributable to the substance use navigators. You are driving this, you're getting your institutions going. It's all your work. So this is amazing. Naloxone for all. Again, what we're doing with naloxone is we're giving this life-saving antidote to everyone. This is all the people who are not engaged, who are engaged or not engaged. It doesn't, in terms of following up, getting into MAT, getting into care, wherever they're at with their substance use, they all get naloxone. They all have the chance to save a life, have their own life saved, and then continue on the road to recovery. Yesterday, I had a meeting with UCSF, and I think it's instructive to kind of go through the elements that help their program get launched. So the steps that they went through, we were using the quick guide, which we're now referring to as the checklist that I went through on our last presentation, which is just a one-page summary of sort of the steps you go through. Like step one is, meet with your emergency department director, your pharmacy director, and the nursing manager, the 3 people you need to be on board. And then it goes through just like, there's like 9 or 10 steps. So Cecily, who's a social worker at UCSF, because they're between substance use navigators, she went through that check. She reached out to me. I gave her the checklist. She went down the checklist. She used the templates, the Microsoft Word templates to fill in her forms, which takes about 5 to 10 minutes to fill those in. And then she actually set up a Zoom meeting with the ED director, the pharmacy and nursing, social work, and myself. So they just felt like it would be helpful to have me, there's all the forms, all the documents, and all the checklists, but it is helpful to, I'm really happy to be brought into these conversations just to really drive home the elements of the program. The fact that it can be anonymous, it's low barrier, it's high volume. There's all the restrictions that apply to medications and healthcare do not apply to this program, and just make that really clear and get the program off on the right foot. And then I sent some custom labels. You'll see down here in the right corner. They say UCSF, and then they're going to look at this and then see if they like the wording or whatever, and what the best phone number for the substance use navigator. And then those are going to be put right on the kits. And then they're ordering 400 kits to start. So that's just an example of how just the boom, 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 and how the program gets launched and sort of off in the right direction. So that's inspiring to me. Inspiring story number 2 is the FENT check. So FENT check is started by Dean Schutt and Allison Heller, 2 people who live in the East Bay. Dean actually came. So this is sort of the impact of building culture at your site. So because of the early work that Highland Hospital, where I work at in Oakland, has done around opioid use disorder and treating it right from the emergency department, that attracted this man who is like he's like a retired IT tech person who came to work at Highland because he read the New York Times article about what we were doing with opioid use disorder in the ED, came out of retirement and went back to work at Highland because of that. And that's sort of like how you start to build culture and change your entire institution. And he is so, the reason he came out of retirement was he's really interested in fentanyl test strips and getting them into nightclubs and bars so that people can test their drugs. And they set it, he and Allison set up this this program called Fent Check. And so what the partnership that we worked out recently was, I suggested that they actually have naloxone as well. So now they've started to, you walk in, so we set up these little kiosks or these little stations that you see on the right, which is a little stand you can walk in and take naloxone, and there's a fentanyl test strip attached to it too. So this is getting really close to the Halloween basket model of fentanyl naloxone distribution. Which has been a long time dream of mine personally. So this was amazing to just have this in a bar. You walk in, and we have this now at multiple bars. We put it out the first night. They had like 25 kits immediately, and they all were disappeared over the course of that weekend. A reporter came in and saw it. So from Berkeley side, Laura Casey happens to be going to the Legionnaire Saloon, sees this, goes, "What's this about? This is amazing." She writes up an article in the Berkeley side, profiles it. We see these nice naloxone kits, and you can't see on the backside they have, it has the substance navigator's phone number and information on the backside of each naloxone kit as well. And then, of course, it gets picked up by the evening news. So we have our kits here, the naloxone kits, and on CBS News, the whole thing. So this is just how, I find this just really inspiring to just see how these things kind of the ripple effects of taking, steps beyond just distributing in the ED, like thinking about ways we can get this out to the community. And one loophole in the entire distribution system is that there's no limit to how much one person can receive. So Dean I'm able to distribute to him a bunch of kits. I gave him 25 kits that I distributed to him, and then he redistributed it through his program. So we're using the ED distribution as a portal to get it to other nonprofits and agencies that are in the community to redistribute to get to the target population. And then the last thing I want to mention is Northern Inyo. Arlene Brown and Steve Dondero have done amazing work down there, establishing in their healthcare district a syringe services provider. So their healthcare, they have an office. They're a certified needle exchange or syringe exchange or syringe service provider. And we are going to the next step. At Highland, we are going to be, our actual emergency department itself is going to be, I think it will probably be the first syringe service provider in the country that's operating out of an emergency department. And my ask to you all on this webinar is, if you feel like your institution might be, I need a couple of partners to join this effort, to have their EDs become clearing. Basically, it's a clearinghouse, is where we get our syringes and supplies from. And I want some early adopters. If you feel like you have the institutional readiness and you're ready to start doing more harm reduction and start having clean, sterile syringes coming out of your emergency department, please reach out to me, and we'll partner up and become sort of the vanguard of maybe 5 sites that are going to be early adopters and set the standard for the rest of the program. And that's all I have for my inspiring stuff, other than just gratuitous pictures of naloxone heading out in the community. This is me. This is how to get a hold of me, jluftig@cabridge.org. And this is my cell phone number. This 415 number is my cell phone number. You are welcome to text me, particularly if you have any questions or barriers you're facing, or want to set me up with a Zoom call with your pharmacist and your ED director. Please reach out. That's all I got. Thank you.
Josh, that gave me goosebumps. The nightclubs and the fentanyl and the Narcan. I mean, I had tears in my eyes of happiness. I mean, this is amazing work, and our sons are the front line to hear this work being done. And just think of the creativity that our sons, because I know they're amazing and they're awesome, and you know how far this could go, you guys. This is amazing, and that is great inspiration. And for those sites that don't have it yet, don't worry, because you have Josh in your corner, and he made a wonderful tool, not naloxone distribution process, and that is on our website. So we will put that link up or you can just head to our website. If you type in the search naloxone distribution program, it is all written in step form for you guys to become one of the naloxone distributors. I can honestly vouch for Josh. It's a very simple process. He made it amazingly simple. So if you want to do this, going from 29 sites in 2018 to 80 for 2020, with, I mean, only better things to come. Thank you, Josh, that you were such a great inspiration.
Thank you.
Amazing. Okay, moving forward, and I just need you to allow me to share, Josh.
Oh, okay.
Okay. And moving forward, let's go on. And I think you're all with me on, just thanking Josh. Next up is our community partners panel. And we have resources for rural and special populations. We have Next Distro, which is a special harm reduction program, Bright Heart Health, and Tribal Health. We are so excited. This is their first actual engagement with us. So we just have, like I said, we have the A-team, we have the Avengers here. Josh started off, we'll put him, he was the lead Avenger there. So we are definitely going to start off with Next Distro. Do we have, there was a little change in the program here. We expected Sean Solis, and he had an emergency. So I am so thankful. Jamie Favaro is the executive director, and she had time. So we thank you so much, Jamie, for coming and joining us to kind of tell us about your program. And thank you.
Yeah, thank you for having me. And I was, as you mentioned, Sean couldn't attend. And I was really excited about stepping in because I really appreciate this group and thought it was really important to connect. So thank you for having me. My name is Jamie Favaro. I'm the executive director of Next Distro. We are the country's first online and mail-based harm reduction program. We are founded in 2017. I myself have been working in harm reduction and syringe exchange for 20 years now. And in about 2016, I heard a woman named Tracy Helton speak about mailing naloxone to people she had met at Reddit recovery forums, and folks who were in rural spaces. They lived so far out that when they called 911 for EMS, it would take so long for EMS to arrive at their rural home that folks were dying because they didn't have naloxone accessible. So Tracy just started mailing naloxone out, and I heard her speak at a harm reduction conference in 2016. And I myself had had a history of founding and scaling up syringe access, and was really intrigued with Tracy's model and thought about what would a syringe access program, a harm reduction program look like if we utilized technology and the internet to provide resources, education, and support, and then use the mail to ensure that people have all of the supplies they need to keep themselves safe and well and alive. So that led to Next Distro. Next is an acronym for Needle Exchange Technology. So as I mentioned, we were founded in 2017 in New York. We are a New York State licensed syringe access program. And as soon as we began, we started getting requests from across the country. Although we were founded in New York, we found that the most need for our services are outside of this state specifically, lots of southern states and rural spaces. We were getting a lot of requests from rural counties in California. So thanks to a partnership with the California Department of Health, we expanded to this state in 2019. And we've had a significant success in ensuring distribution of harm reduction supplies to people in California who cannot access in-person services. And I want to emphasize that it's never our intention to take people out of in-person service. When we receive applications for enrollment, we first geolocate them against syringe service database to ensure that if they are in a community with a syringe access program or one that is in a delivery catchment area, we're always referring people into community-based programs whenever possible. What we're doing is filling in the geographical gaps where there are no existing programs. I'm super excited about learning about this ED SSP project. That's thrilling. So I'm looking forward to partnering with the hospitals that are taking that on. For us, we're mailing supplies. We have an enrollment, an order form, and we also have a naloxone program. Also, when we started, we were first and foremost a syringe access program, but we were getting so many requests from friends and family who didn't want syringes. They wanted naloxone. They had, children, family members, partners, coworkers who are using drugs and at high risk of overdose. So we founded an online and mail-based naloxone distribution program. There's a brief training, and we'll mail people naloxone in discrete packaging. We actually operate in 38 states, thanks to affiliate partnerships. In California, our affiliate partner is Berkeley Need, so our office is in Alameda. I'm actually not sure how much time I have since I just launched into that. Can someone tell me? Or
yeah, you have about 3 minutes left.
Okay, great. So to emphasize what we do, people who are enrolled in our program can access anything that they would receive at an in-person syringe exchange program. That means hazardous waste containers. We have 4 different sizes. We also offer syringe clippers, which are home has waste devices, which clip the tip off of a syringe, and then it renders the syringe, like you can put the barrel in household garbage. We have well over a dozen different size syringes, glass, safer sex, safer smoking, fentanyl test strips, Narcan nasal spray, as well as intramuscular naloxone. And then, so it's not just like providing supplies in a package mailed. It's not like Amazon for needles. I don't like hearing people refer to our program like that because it's very different. Actually, in each, I wish I had an example, but in each package, there's a lot of information education, and there's also a handwritten note in every single either naloxone or the full service program, and it's written by the staff member in and it directly correlates to the enrollment request. For example, if someone's asking for more wound care materials than possible, if someone is asking for more wound care materials than usual, or if someone mentioned that they reversed an overdose in the order form, then we're responding to those directly in the handwritten note. So there's a real warm touch and a real warm feeling. We also have like an online like a phone number, phone ordering for people that have difficulty with internet access. We're building a resource library online. It's at nextdistro/resources, trying to develop a consolidated hub for drug user health information that's accessible, readable. A lot of folks have limited literacy levels. Right now, we're translating a lot of materials into Spanish. So this program is an excellent opportunity if you're encountering folks who are having problems accessing in-person services. We will mail them supplies. And again, if they don't have the internet, they can call our phone number. So I'm happy to answer questions or include more information in the chat.
Great. Thank you so much, Jamie. I really want to stress we do have some rural hospitals here that are presented. And, when we heard this as me and our mentors, a couple of them even tried it to see what it's like and how it comes and discreetly and all of those things. So patients really don't they're not going to be signaled out. It's not Amazon, I really want the confidentiality, the privacy. Can you explain about that?
Sure. Packages come in discreet. I'm sorry, I wish I had an example to show you. Packages come very discreet from a mailing address that is also discreet. It doesn't say like next distro, syringes, and naloxone in your package. The idea is that we want to afford participants as much privacy and security as possible. We use all encrypted communication channels such as Signal and Proton Mail. We're actually right now building an encrypted app for people to order and enroll that doesn't use a third-party service. So because Next operates nationally, we have a lot of states where there's drug-induced homicide laws, and we're very concerned about someone accessing information from our participants. So we've put a lot of our effort into ensuring that people's privacy is it's foundational to our core values.
Thank you. I just really wanted to stress that because I know a lot of our patients they want to be discreet. They don't, need that privacy. So again, a great resource. I really encourage those in a rural area where you can't get to your patients or your patients need to travel, for many hours, right? In Northern California. This is a great resource. So thank you, Jamie. Thank you very much. Next up, we have Bright Heart Health. We have the wonderful Aoka Joyce de Guzman. She is the case manager supervisor for Bright Heart Health, and her department facilitates and coordinates patient care with partners. And this is telehealth. So I'm not going to say any more. I'm going to let Aoka take it away. Go ahead. You're going to start your slide. Go ahead.
Yes, thank you so much for having me here. I am going to share my slides and give you a brief overview of Bright Heart Health. So here you go. Bright Heart Health is 100% telemedicine. So we see our patients via Zoom. So we do have that extra encryption with Zoom to make sure that all of our appointments are secure and that we are HIPAA compliant. So we have on-demand services. Our clinic is 24/7. Our intake coordinators are available to assist patients, whether they would like to see us through Zoom or via phone call. It's fine because both channels are available 24/7. So it's really easy for patients to access our services because they can use their own device. And the good thing about it is that if they feel like, oh, I want to change, I want to enroll at 3 a.m., they have these thoughts randomly during the night, then they can come into the virtual clinic, complete their intake, and then get scheduled for an appointment with our provider. And they will get that schedule, as soon as they complete the enrollment process. And we have services. We are active across several states. So our providers are able to see the patients the same way that we're doing right now. So pre-pandemic, we actually had some states that required patients to be seen in person for the initial appointment. And then we would move towards the telemedicine approach from there. But because of the pandemic, we have been able to see patients all telemedicine. So I am unsure if that's going to change in the future, but for now, across all states, we are 100% telemedicine. And our programs are we have opioid use disorder, substance use disorder services. We have mental health services, pain management, and eating disorder services. Yeah. And we have a very comprehensive and holistic approach with our treatment. So each patient is assigned a provider, a therapist, a case manager, a care navigator, a wellness coach, and if they need one, a dietitian or a nutritionist. This is because we believe in consistency with treatments. So when a patient comes in and when they start into our program, they will be seeing that one set of treatment team consistently. And that really helps us with their relationship with their providers, and they have a better adherence to the program just because they have that relationship with their treatment team. So we have a very holistic and individualized care for our patients. So let's say, for example, a patient is referred to us for opioid use disorder, and we assess that and we treat that. But we all know that majority of patients with OUD would most likely have a co-occurring mental health diagnosis. It's very common. And we believe that we are able to treat the addiction much better if we also address the mental health problem. That's why we have providers who are able to address that internally. So if our, say for example, our addiction physician would recommend the patient to be seen by a mental health provider, then we are going to coordinate that internally so that they will have that assessment. Same thing if, for example, a patient is referred to us for pain management and we believe that there may be some OUD, then we are going to have that coordination internally so that we can address all diagnoses for patients. So not only that, we have a very evidence-based approach. Our CEO, John, he is able to collect data in a very, we are very metrics based, so it's easier for us to see a patient's data right away, and our providers are able to make that assessment accurately. So we do have several surveys that we have our patients complete upon intake, and during the enrollment process, our intake coordinators are able to provide assess for their level of care. So we have ASAM, SBIRT, certified intake coordinators. We also conduct the PHQ-9 GAD-7 survey and other related surveys that they need. And during the patient's treatment with us, we also conduct brief addiction monitor surveys every week, PHQ-9 and GAD-7 every month. We also have pain surveys. We have other related surveys that would be, we think, would be beneficial for the patient to complete. And they are all incorporated into their chart. I'm going to show you in a bit how it would look like. So we are partnered with several facilities. Actually, we have been working with UCLA on the NIDA study. We have been studying the effectivity of telemedicine for rural areas. So that's a study that's ongoing right now. We are also accredited by the, we have the Joint Commission approval on our website. So those are some of our partners. We have a lot more. And I actually recognize a lot of the names here. We are working with them directly. So thank you very much. It's nice to see you here. And there you go. We have over 90% of our patients have a retention rate of 30 days or more in the program, which I think is very good because providers know that getting the patient into the program is one thing, but having them retain that engagement is another problem. So we do have a good retention rate. And we also do drug screenings monthly. We do have that cup that we mail to the patient. So we have a 97% of our patients are negative for opioids in the 90 days that they are with us. So I think that's a good score. And while more than 85% are negative for opioids, stimulants, and other sedatives. So this is what I was talking to you about earlier. So we have our patients complete survey, say for example, every month, and our providers are easily able to assess their progression in the program because it's integrated into the chart in this manner. So you will see they have a high PHQ-9 score at the start, which the score would gradually decrease as they move towards their treatment planning with us. So these are some of the charts. Depends on the program that they are engaged in. These are actually, we can also share this with our partners if they would require it. Our case management team sends continuity of care and progress reports so that we can update them of the status in program. So I do have some questions that I want to see. There you go. Oh, thank you, Lisa. Yes, I'm working with Lisa too. Thank you for that.
We have a couple, and some wanted to say if they have a patient in their area and they go to a different state, will you follow them on telehealth?
Oh, yes, we have that. So it just depends on whether or not we are active in that state. But we do have, yeah.
There's a question about, do you accept Medi-Cal?
Yes, we do accept Medi-Cal. We are able to accept straight Medi-Cal, and we also we are credentialed with majority of the MCOs for Medi-Cal.
Okay, awesome. Any other questions? Ayoko, can you put your email if they have any other questions?
Sure, I will be able to put my email here. And what are the other payment options? So yes, Medi-Cal, Medicare, we accept commercial insurances, and we have self-pay options too. And I can send the list of states that we have providers at. So would it be okay, Sherry, if I send you that list and then
yes,
you can?
I can send it out with a follow-up. That would be great. Thank you so much. This was so helpful, and I'm so glad that you got testimonials from our sons that are already using you and find your services with integrity and very patient focused. So again, thank you for a great presentation and just keeping us updated. We really appreciate it. Thank you. And if you can, keep in touch with us.
I will do that. I am going to provide some documentation as well. And in fact, if you are interested in seeing our virtual clinic, I can share that too, unless we don't have any more time.
Yeah, we could, if you want to, do you have a link or something we can post?
Oh, sure. I can go ahead and share with you. Actually, I'll just share with you the document that has the different ways that we can receive referrals, if that's easier.
And I do send a follow-up email so we can add it to that. So definitely we'll do that. Thank you so much.
Thank you. Thank you as well.
Okay, our next panel we're coming up to is the Tribal Mat Project. And I have Daniel Damaguen, a second-generation Ilocano immigrant. I don't know if they said that right. Born and raised in Taipei, Southern Kumeyaay Territory, South San Diego. He earned his Bachelor's of Art from Oberlin College and has a Master of Social Work from University of Michigan. He has been serving California's American Indian, Alaska Native communities through behavioral health programming since 2009. Daniel is currently the Behavioral Health Clinical Manager in the Research and Public Department at the California Rural Indian Health Board. We also, not sure if Hannah Young Deer is going to make it, but she was representing today the California Consortium for Urban Indian Health. And she is a member of the Eastern Band of Cherokee Indians and is the Public Health Program Coordinator at Matt Champion for California Consortium for Urban Indian Health. So it is our pleasure for the first time bringing tribal health to our sons. And we're so excited to have you guys here. Like I said, we have the Avenger team. We have just some great speakers today. So I'm going to hand this off to Daniel and Hannah.
Awesome. Thank you so much, Sherry. So Hannah and I will kind of trade back and forth to share about the Tribal Medication Assisted Treatment or Tribal MAT project. Starting with Hannah.
Okay. Hi, everyone. It's nice to meet you. So I'm going to tell you a little bit about our organization. So as Sherry mentioned, I'm one of the public health program coordinators with the California Consortium for Urban Indian Health. And our organization is a nonprofit. We're an alliance of the 10 urban Indian health organizations throughout the state of California. We support health promotion and access in the American Indians living in the cities throughout California. We serve one of the largest populations of American Indians in the state. And we provide assistance to all of our urban Indian health organizations, but of course, any other tribal-based organizations that reach out to us. We also help and assist with services that they may need. Our mission is to facilitate shared development resources for our members and to raise public awareness in order to support a health and wellness network that meets the needs of American Indians living in urban communities. So in addition to providing TA services for public health services, any clinical services, we also do a lot of policy advocacy with the state, which is one of our major roles in helping our urban Indian health organizations. So these are the members that we serve. As you can see, we start from Northern California all the way to Southern California. I believe you all will receive these slides after this, so I won't go through all of these, but we do serve a plethora of our urban Indian health organizations. Some are clinics, some are residential treatment centers, and some are purchase and referred care. And some are transitioning from purchase and referral to full functioning clinics. Go ahead, Daniel.
Awesome, thank you, Hannah. So the California Rural Indian Health Board, or CRIHB, is a sibling organization to SACUI. While SACUI serves the urban Indian health organizations, CRIHB serves a network of tribal health programs. They are controlled and sanctioned by the Native people and their tribal governments. We are committed to the needs and interests to elevate the health conditions of Native folks in California. And we do this by providing advocacy, shared resources, training, and technical assistance. Indian Health Service actually wanted to pull themselves away from California back in the mid-20th century, and CRIHB was formed to say, no, Native American people are still here, and by treaty rights, you are required to provide this healthcare to Indian people. So CRIHB has a history of providing the advocacy to ensure that Native folks are receiving the care that is required for them. So CRIHB currently has 18 member tribal health programs that serve 58 federally recognized tribes. For the tribal MAP program, we serve the entire state. So while our core membership are these 18 tribal health programs, we serve all of the tribal health programs in the state, as well as non-federally recognized tribes. So funding for Indian Health Service is mostly for the urban Indian health programs and federally recognized tribes, but this funding, since it's through the state, we are able to serve all tribal partners, including those who do not have federal recognition. And just wanted to show this map. There are both tribal and urban Indian health programs all around the state. Take a look at this map. Feel free to screenshot it. And again, you'll get a copy of this PowerPoint, but there is very likely a tribal or urban Indian health clinic somewhere in your area. So if there are Native patients that you get and are curious about where to refer them, these are among the places that you can refer them. So a little overview of the Tribal MAT project. We receive our funding through the Department of Healthcare Services. It is a partnership between the California Consortium for Urban Indian Health, California Rural Indian Health Board, UCLA, University of Southern California, and Kaufman and Associates, which is a Native-led training and technical assistance organization. We provide a lot of programming, opioid use disorder and stimulant use disorder prevention, opioid use disorder treatment and MAT access expansion, naloxone access expansion. So we provide both naloxone training as well as naloxone kits free of cost to any of our Native stakeholders across the state. And we also have assistance in supporting and developing the clinics in what they need in terms of opioid use disorder prevention. And yes, all the clinics, not all the clinics, but many of the clinics are able to take patients regardless of race. So check with your local clinic. It does kind of depend on where they are, but for the most part, they're all clinics who do receive local government funding and are able to also take patients who have insurance. So Hannah, I was wondering if you could take this slide.
Sure thing. So our tribal map program really is a unified response to the opioid crisis in California Indian country. And what is really interesting about this project is that a lot of times urban programs and tribal programs can be really siloed. But this project has allowed us all to come together and reach all of California Indian country as a whole. And so we do that in a couple of different ways. We have a tribal and urban Indian culturally defined best practices grant, which was just released this year, which is allowing our programs who have applied for that grant opportunity to take their culturally defined best practices that they have in their own tribes and tribal communities and integrate those into their substance use disorder programs or in any opioid programming that they have. The other thing that we work on together is the California Indian Opioid Safety Coalition. And this is just a gathering of our organizations to come and talk about what is happening in California Indian country and what resources are also out there for everyone. The other thing we have that we're working on is the California Indian Harm Reduction Work Group. And so that is a new thing this year, but it's very similar to the California Indian Opioid Safety Coalition. But it's bringing together all of our organizations and whoever is interested to talk about what harm reduction is looking like in our communities, what's missing, what kind of action steps can be taken. And that group is actually really going to be guided by the community because they know their communities best and what they need. So those are three of the things that we're working on really closely together.
Thank you. And the California Indian Opioid Safety Coalition, or kiosk, that is open. So it is not just Native programs, but they are also Native serving organizations, which include all of you all. So at the end, you will get our contact information and you're welcome to ask us about the upcoming kiosk, which is in, I think, about 2 months. They happen quarterly, and you're welcome to attend that meeting. I'm going to skip along because we have about 2.5 minutes left. But we both CRIHB and CRIHB worked on a culturally adapted opioid campaign. So there are a variety of culturally adapted education materials that you can provide to your patients in the waiting room or whatnot. You just have to contact CRIHB or CRIHB and we could send these over to you free of cost. And we'd be happy to provide you this. These are just a couple of samples. Created by Jackie, one of the great artists who works with CRIHB. There are many other ones, but we don't have all of them in the slide deck. And both CRIHB and CRIHB also have local opioid coalitions that are focused on doing education and training, as well as naloxone distribution across the state for both urban and tribal communities. So the urban Indian health programs all have a form of a coalition, those that were listed earlier. And we also have tribal local opioid coalitions across the state that are listed here. So if you are interested in attending one of these coalitions because they are in your area, seeing if your department or your hospital wants to be involved with one of these coalitions, you're welcome to contact them. And here is our contact information. I think we have 20 seconds for questions.
A few seconds. I know there was some on here. I know I'm not sure about this one. Can you talk about
Wellbriety? Yes. So many of the clinics in their substance use disorder programs do provide Wellbriety. It's a culturally responsive form of treatment for Native American folks who are going through recovery. It's offered in, I think, most of the clinics, both urban and tribal. It involves groups as well as cultural activities. So contacting us, and we could give you contact information for your local Indian health program. You could also contact the Indian health programs directly about their Wellbriety programs and what referrals would look like for that.
That's great. I know we have so many questions, and there is Hannah and Daniel's contact information, and I'm definitely going to have them back for training. This is way too short, so we will definitely have you back to speak to more. I know there's some one more question about what we're doing, anything for National Overdose Day in San Diego. Somebody wants a contact to see if you guys want to reach out in a local chapter. And actually we're in the planning stages ourselves for California Bridge to bring National Overdose Awareness Day. It's August 31st. So definitely some plans, and you will also receive this slide deck. And like I said, we will have you back. I thank you. One of the things I just want to say is if you've ever been to one of their trainings or anything that CRIHB or CRIHB puts on, it's so emotional. I just want to say thank you. I went to a training, and the whole singing in the ceremonial song in the beginning, and we didn't have time to, but I would love for you to do that. That is so healing and so cleansing. I think about it and I was like, taken away. So I definitely want you guys back. Okay. Thank you so much.
Thank you.
All right, so we're going to go back to our agenda. I know we have just a short amount of time, but we are going to continue going. I have next up LaToya.
Hi, everyone. LaToya from Bakersfield Memorial and Sun Mentor for Dignity Health in LA area. So engage your community. Getting to know your community is very, very advantageous. You'll want to touch bases with county entities, and then especially public health. You can go on to the SAMHSA treatment locator and find what other resources are available in your community. The California Opioid Dashboard has statistics available, not just statewide, but you can narrow it down by county if you want to know your specific county statistics. You want to meet with community partners and network. Grow your support system and your resources for yourself and your patients. Find out who dispenses naloxone, especially if your emergency department doesn't have a naloxone distribution yet. And I say yet because we hope that eventually you will. Know where your local food banks are, your shower stations, where your local homeless shelters are, things like that, so that you can provide these resources to your patients. And then another thing really important about getting to know your community is just the involvement in general. So like Sherry mentioned, August 31st is National Overdose Awareness Day. It's a really big day. And it's not just opioid overdoses, it's all overdoses. But it kind of kicks off the whole month of September, which is National Recovery Month. So especially since things are relaxing as far as, safety guidelines. Hopefully there will be table events and resource events that you can get involved with in your community. And I really encourage you to do that. And please share pictures with us once you do.
Right. And the whole, the pictures here is for our Sacramento team. They put this on our Slack, and I just wanted to give a shout out to them for making those community partnerships. This was their adventure, right, you guys? So very excited to see what you guys are doing. Real quickly, we're going to tell you a story from Tommy Trevino. He's going to tell you about his process for engaging in the community partnerships. Tommy?
Hello, everyone. My name is Tommy Trevino from UC Davis Medical Center in Sacramento. Yeah, I was just thinking what Brightheart came out in Sacramento Native American Indian. When I first started the buprenorphine, I couldn't even hardly pronounce it. And so my first thought was, if I get somebody started on buprenorphine, what am I going to do with, where am I going to send them? So one of my first partners was Brightheart, actually. And they came out, they brought me an iPad. We were able to get people connected. So they were my very first ones. It's important that for me to sit down, I invited them over to the hospital. I wanted them to see the people that I work, that I help. And then when they came out here and seeing, I feel this is the population I work with. Can you help me? And so I Googled community partners, not community partners, community clinics. I come up with Sacramento Native American Clinic. I also invited them to the hospital to come visit me. I gave them a tour, and then they invited me to their clinic, and they gave me a tour of their clinic. One Community Health, there's another clinic that I built a strong relationship with, Dr. Casper and the nurse practitioner, Brooke Fillmore. We have lunch once in a while. We meet up for coffee. I built that strong relationship up with them. So if something happens with the patient, say they fall off the buprenorphine and they want to get started again, they might call me. Hey, Tommy, we got this patient coming to the hospital. Yeah, send them right over, and we help each other out. And the same thing goes with me. I mean, have somebody that needs a dentist or a psychiatrist or a counselor or so on. These clinics, you need to find out exactly what they offer. This way, when you have your patient, you can tell them, hey, they have a dentist here. You also have other issues that you need to take care of. So it's really important to stay connected with your community partners. And I stay real close with mine. Like I said, I invite them to lunch all the time. They come over and visit me, and that's building community partners and building relationships. And I have somebody right now here, Yvette from Modesto, shadowing me. She's been shadowing me for 3 days from Sutter Health.
Thank you, Tommy. That's great. I'm glad. And that's just tips from our mentors. We understand we're going to go over a little over. If you have to leave us, please, we totally understand. But we're going to continue on. We have Promoting Your Substance Use program with our son mentor, Rebecca Bartley. She's going to give us tips on developing your own community resources. Rebecca?
Yes, hi everyone. I wanted to go over, if you would advance to the next slide, please, some staff resource lists and patient resource lists. So this is just a really brief example of how you can track your community mapping and who you've engaged with in the community. As you can see on the right, it's really important to have all of the national hotlines, but there's also going to be local, county, and community resources. You can put this in a Word doc and an Excel doc, whatever you prefer. But as you're going about connecting with your community, add these down. You can add notes like, if they accept insurance or private pay, or if they're volunteer-led. It's important to have also pharmacy resources. As you all know, as substance use navigators, navigating folks out of the emergency department, local mapping of pharmacies that carry buprenorphine and will treat your patients with dignity is very important to our resource list. So you can, get as advanced and creative as you want, putting all these in a list, getting them out to your staff, making sure all your providers know which pharmacy to send your patients to, for example. But it's really centered around community mapping. And as I said, knowing exactly what's in your community and then documenting it. And the great thing is that you can put all three of these presenters who are wonderful, they give us so much info today, CRIHB, CRIHB, and Next Distro and Bright Heart Health. You can add all three of these to your resource list today. Thanks, everyone. Next will be Angela, I think.
Angela's not going to make it today. Next up, we have Christian Halosian. Are you okay? He was working, so we weren't sure if he was going to be able to. He's going to talk about the next slide, which is just promoting your program through community events and just getting creative. Christian.
Hi everyone, good morning. So I've been running around doing this kind of patient navigation work and running the clinic today. Funny thing is, Josh kind of beat me to the punch here with these kind of community events and creative ways to get your community engaged and involved. And everyone thinks of community as outside of the hospital, but the hospital actually is your community as well. So, we talk about, promoting your program and how to, kind of bring patients into care, because patients won't really know to seek treatment if they don't even know that there's a program. So I don't know if you guys can see me here, but Josh has these, Narcan boxes that we label here at Highland. One of them says, carry naloxone, save a life. One of them is the suicide prevention line. And then it's a huge, huge thing. I've seen them all around Oakland and San Francisco is our boxes with the phone number on them and offering patients, any substance use disorder treatment, and not just offering your hospital, but maybe another local hospital that you might not be a son for. So we have here Highland, San Leandro, Alameda Hospital. And our number, a number to call the sons, to call your hospital, and just providing them access to treatment. A simple thing here. I don't know if it says, are you seeking help for substance dependence recovery? And giving this to, not just places that are offering drug treatment, primary care doctors, homeless shelters, places where people can seek just general social services. I don't know if I do. I might have a harm reduction kit back here. And then just other general things, a brochure and a flyer and whatnot. Passing this stuff out to social workers who may not know much about substance use disorder. I see a bunch of people asking for the labels and whatnot.
We see that. We might be onto something. We might have to bail out Josh. So he's might get inundated, but we'll figure this out. Definitely, people want the labels. And let me tell you, I saw that firsthand, and it is so impressive because they are bright, fluorescent. You can see all of the information. And Josh is saying flood them with messages with a smile. So that is so impressive, Christian. Any last words? Yeah,
one last thing, maybe for within your community, your hospital. It's kind of small here, but we all have badges, and this thing says, addiction treatment starts here. I can help you get started on buprenorphine. If you have questions about substance use, this stuff is really good for engaging, nursing staff, doctors, your janitors and your registration people, English, Spanish, great stuff to really engage your community within your hospital. And of course, your outside community as well that Tommy talked about. It's super important just to help educate everyone that help is here. And
and everybody's impressed with your badge holders, and we are in the process of making more our comms team. So these are some of the goodie things that we will be, having having more produced. So definitely
Much better
stay
than the
tuned.
hospital ones Highland gives us. I will tell you that. These things last a long time.
Definitely. Thank you. So some takeaways real quickly: start your naloxone distribution program, helpful resources or through your own local community, California Department of Health. Check out the California Opioid Dashboard for your own local stats, and some ways to promote your program, or just education, flyers, anything you can find. Attending community events is really instrumental. We have our evaluation form that's in the chat. If you need CEU credits, please complete that. Very important, just to evaluate our program, what you like. If you want more panels like this amazing Avenger, I don't know if I can ever supersede this. This was totally amazing, but we can always try and hope, or any other suggestions, we want them. Join us on our social media. And also, thank you to our wonderful Sun mentors who always help and put this wonderful program together. Christian, Rebecca, Latoya, Tommy, Wendy is here, and Chaya is our tech. She's been posting everything in the chat. So I thank all of them, and I thank you. I know you're doing really great and awesome work. Stay tuned. We will have some more information about our National Overdose Awareness Day. And again, if you have a special event, if you have more time for training, we have case-based learning, interventions with nursing, what we can learn from each other, on July 26th. Again, our next Sun training program is August 26th. So we look forward to having you, and that will be improving and sustaining your program. We'll get a great update from our data. One way to sustain your program is collecting data, and from our California Bridge leaders. They'll talk about the grants that have been renewed in the California grant. So please join us next month. And again, if you have any questions, I'm Sherry Cisneros, the Sun Program Director here for California Bridge, and I am always available. Thank you so much. And I'm sorry for going over. Everybody was important, and we wanted them to speak up. Thank you again for all your work and for attending. And until next time, everybody, we'll see ya.